I was diagnosed with breast cancer in December of 2005, and I just went in for a screening mammogram. They seen a spot, and they wanted to biopsy it. And when the doctor came in and said it was cancer, I was shocked. That was my reaction. I was just completely blown away, because I just thought, you know, it's going to be benign, I'll be fine, you know. And I tell you, what got me through was my family and my friends and the wonderful medical staff. I would give any advice to someone just diagnosed with cancer is to trust your doctors. They've been through it, they know what they're doing, and it's their thing. So, and they're awesome. The whole medical staff that I had, from my very first diagnosis till I was done with my radiation therapy, everyone that I came into contact with at the Monroe Clinic and Turtle Bay Radiation Center were just completely wonderful people. They're very caring, professional, and make it very easy to go through each step that you need to go through.
One thing I'm very passionate about concerning breast cancer is that women should go ahead and make sure that they get their annual or their regular screening with their mammograms, because I don't have breast cancer in my family, and I got my annual regular every year screening, and 1 year I was diagnosed with breast cancer, and I just feel that if I hadn't had that, then I may not be here today.
I was diagnosed with breast cancer in December of 2009. When I first found out that I had an abnormal mammogram, I really wasn't too worried, because I'd had abnormal mammograms in the past, and it always just turned out to be a cyst that was easily aspirated. But this time it was different. This time I was quickly scheduled for an ultrasound and needle biopsy in our medical imaging department. Since experiencing a serious illness, I have gotten a greater empathy for the patients that I see here at the clinic. I now understand what it's like to have multiple doctor's appointments, and I totally understood the other day when a patient said to me, you know, I just want to be normal. I just wish I could be normal.
When I was told I had cancer, I assume I'm probably similar to most people. It is a terrible shock, and it is terrifying. Fortunately, in my case, maybe part of the shock gets you through it, because you just function for a while and do what has to be done. I am very glad that I had gone for my mammogram. I would have had absolutely no idea a cancer was growing in my breast. It actually has changed my life, but not all for the bad. It has made me appreciate things more, appreciate people more. It has made me more empathetic with the patients that I come in contact with. Because until you've actually heard that word cancer when someone's looking directly at you, you truly don't know the feeling that you have inside.
My story began November of 2009, routine mammogram. I was asked to come back in for additional films, which I did on the next day. At that time I was sent to the radiology department for an ultrasound. At that time they recommended that I see a surgeon. I did see Dr. Maxwell here at Monroe Clinic, and he scheduled me for surgery within 6 days. He was fortunate enough that he was able to remove the lump, and from there I met with the oncologist, who then gave me my choices of treatment. They gave me choices of chemotherapy, radiation. I met with Dr. Hegeman. Dr. Hegeman then said the best course of treatment for me would be radiation. I did not have to do chemo because I was very fortunate that my margins were clear, and they did a sentinel node biopsy in January, and that was all normal. I began my radiation February 1st of 2010, and I went for 7¼ weeks to Madison. Since then, everything has been normal. I went in for my routine mammogram. Everything is good. I'm very, very lucky. My best recommendation is, the physicians did not find a lump or anything with me. It was all shown on mammogram, and it was digital mammogram. So my recommendation to anyone is, no matter what, go get screened. Okay?